medical dream comes true under the drive of industrialist Henry Kaiser, who holds the plans of the ultra-modern hospital designed by Dr. Sidney Garfield, director of the Kaiser Foundation. From the admissions office on, everything is streamlined and expedited.
Trying to plan your demolition and construction cycles in a way to minimize the amount of trash that gets thrown away is not something that occurs to people every day, and so we're trying to revolutionize in some ways how we go about doing so. If we in the healthcare industry can't set the example, then who can?
At Kaiser Permanente, we have a construction and demolition waste diversion program because we know that the landfills in our communities that we serve are filling up, and that the waste produced by our construction and demolition projects can be used in other buildings or in other ways in the process of development of our communities.
This is the LAMC Stage 2 hospital project. There used to be a 450,000 square foot concrete building here. When we demolished the original hospital, we generated 35,000 tons of debris. And of that 35,000 tons, we were able to divert 97% of that from the landfills.
In California alone, we provide health care to over 6.5 million people and have a substantial footprint across the entire state with some 35 hospitals and about 400 medical office buildings. As a consequence of all this activity, it has occurred to us that we need to be more conscious of the effects that it has, positive and negative, on the environment.
This is a small example of 3 different bins that are being used to segregate the different debris that's being generated from the construction of the Stage 2 building. Having these sustainable measures makes the work out in the field more efficient. It makes the site more organized.
We often talk about job sites that it's a mindset and it's a way of thinking. It's the same thing with trying to recycle and not waste material.
These hangars come already prefabricated and cut to the exact size where they need to get installed out in the field, so there's minimal waste.
We became more insistent that not only the products and construction materials that we used in our buildings needed to be sustainable or environmentally friendly, but we wanted to make sure that our facilities did not have a negative impact on the communities or in the general environment where we serve.
This is the shrink wrap that's used to protect the exterior of the building. This minimizes the amount of drywall that has to get replaced due to weather prior to having the exterior skin built.
We are inspiring our project managers by coming up with some incentives for them. Most counties and municipalities only require 50% diversion. On the projects that we've run to date, most have been able to achieve over 98% diversion of their waste from the landfills.
Our primary mission is affordable, quality health care. And by becoming more energy efficient, that can improve the affordability of health care. At the same time, we have a mission to serve the communities in which we operate, and by our commitment to greenhouse gas reduction, we can help those communities and the entire planet. We recently instituted a policy whereby all future major construction projects, all projects over $10 million, will be LEED Gold certified. And we're doing it because it is a way to hold our designers and our contractors accountable to our expectations in regards to sustainability.
A lot of our materials are purchased locally. For example, these metal studs come out of the City of Industry.
That resonates with folks when they understand that their effort on the ground in a particular project makes some pretty sweeping changes to the environment.
Because it really is a team. It's not the general contractor and, okay, the subs are down here and we're up here and the owner's up here. It's a collaboration of all those individuals and all the experiences that really makes for a dynamic, successful project.
Once we get this program up and operating the way that we envision it as an organization, and we start making those gains in terms of our sustainability efforts, it's then how do you share that knowledge? How do you share that experience?
It's community management. Kaiser Permanente's commitment to sustainability has helped set the bar in the construction industry.
We have project managers and general contractors that work on jobs all over the country. The knowledge that they gain from working with our system, understanding how to record the data, document what they've been doing, will allow this information to be shared across the industry.
Figuring out ways to reuse carpet instead of throwing it in the trash, or reusing old furniture, taking it and doing something with it, reshaping it in a way that can be used in other elements of the community who don't have access to it, whether it's here or in another state or even in another country. Those are all ways in which we can contribute indirectly to the well-being of the greater human community.
Within all of LA County, there are only a handful of residential facilities for pregnant women. There are many shelters where women can go for the day, but there's no place that will actually house them on a permanent basis. In this last year, we housed 17 women and 17 babies. Either their family or the father of the baby just decides to reject them and they find themselves on the street. We connect them with the social systems that will help them have a good delivery in the hospital. We give them prenatal care. We give them all the really normal things that you would hope that a healthy mom would have for her baby. Up until we received this furniture from Kaiser Permanente, we had a scary looking office. We had folding card tables, we had broken down furniture, mismatched chairs, different types of file cabinets. It was pretty sad. I just love the idea of how that gets recycled rather than things being put into landfill and causing more problems for the environment. I love the joint passion that we have for restoring people. Kaiser Permanente is restoring people in their health, and we feel that Harvest Home is a place where we're restoring people emotionally and physically.
We are looking to expand our program. In the past years, we've been focused on the Californias. Now we're trying to expand it to all our regions.
It'll be very exciting to see other general contractors out there try to achieve 100% diversion rate.
The facilities that we build touch so many lives, and they help so many people, and Kaiser's certainly on the forefront in a lot of ways.
No stance around sustainable design can be effective unless it is embraced on all levels of the organization. So from the highest executives to the nurses, to the physicians, to architects who work with them to build facilities, to the folks who maintain those facilities, if it's embraced on every level, we will truly make a difference.
There is a direct tie between what we do to prevent pollution, to prevent waste, to encourage recycling, to encourage safer products. All of that contributes to a healthier environment.
But ultimately, it's about something bigger than ourselves. It's about a goal, a mission. By setting an example, we can show others that you can do this in a way that in the long term can be economically just as rewarding as doing it the old way that was more harmful to the environment. So we think there's a lot to be proved here, and we aim to do it.